The purpose of the symptom checker is to help you decide whether or not you need to go to the doctor for particular symptoms. If no visit is needed, the tool provides step-by-step advice so you can take care of the symptoms at home. The symptom care guides are evidence-based and have been tested in millions of scenarios. You can trust them. The care advice is the same as used by nurse helplines and in physician practices. The content was also selected by Harvard physicians as the most reliable symptom checker available on the market. Symptom checks take less than 3 minutes to complete. Once you open the app, the first screen you come to is the Home tab. Click on the Symptom Checker button to open the symptom search engine. The app includes 250 care guides, so the first step is to find the care guide which matches your or your child's symptom. Tap either adult or child, depending whose symptoms you are going to check. Then you can search using an alphabetical list of topics, the body area avatar, which we will view in a minute, or you can type in a keyword or phrase. The alphabetical list presents the symptom topics from A to Z. The body area search presents an avatar. Before we select a body area, please note that there is a skin category in the lower right. The skin category covers dozens of topics, such as bites and stings, burns, rashes, and injuries to the skin. Let's go back to the avatar and look up a common symptom, sore throat. You can find sore throat by tapping the mouth or throat of the avatar. Notice that when you touch any area of the head, the picture zooms in for a better selection. By tapping the neck or back area listings display. Tap on sore throat to open that care guide. Notice that each care guide has 4 tabs or steps to follow. The first one is problem. It asks, is this your child's symptom? If the description matches your child's health problem, then you move ahead to the next step, what to do. If the description is not a match, then consider the related care guides which are listed below, such as cough, croup, and others. Let's assume the description is a match. The first thing you see on what to do is a message that most illnesses do not require a visit to the ER. Tap OK, and then you will see the sore throat questions. The instructions are to select the first symptom that applies. The care guide starts with the most serious symptoms and then scrolls to less severe symptoms. Starting from the top, read each statement and decide if it matches your child's symptoms. As long as the statements are negative, that is, do not match your symptoms, keep scrolling and read each one. When you find a statement that matches, tap it. Let's choose sore throat with cold cough symptoms lasts more than 5 days. Once you tap the matching statement, a pop-up recommends what you should do. In this case, you are to call doctor during office hours. The other recommendation is to read care advice. The care advice provides step-by-step instructions for managing or relieving symptoms at home. Sometimes it mentions an over-the-counter medicine you can buy at the pharmacy or grocery store. Notice that some of the drug names are hyperlinked. If you tap a link, the app will open the dosage table for that drug. Tap back to return to the rest of the care advice. Care advice also tells you when it's safe to return to school or work, and how long the symptoms may last. The last section, Call Your Doctor If, lists symptoms you should watch for. These could mean your symptoms are getting worse and should be checked again. The last tab shows a summary of your symptom check. If you wish, this can be emailed to someone else, like a babysitter, daycare, your spouse, or maybe a friend who does not have the app. Tapping Email Summary and Care Advice launches an email, which includes the summary and all of the associated care advice. So to recap, the purpose of the symptom checker is to help you decide how sick you or your family members are and whether or not you need to go to the doctor for your symptoms. It also provides step-by-step care advice when you can safely manage symptoms at home. Symptom checks take less than 3 minutes to complete.